All right, everybody. So for the last video, I'm just going to go from the 71st question to the last question. So 71 through 100. So question 71. What diagnosis is most likely in this patient with hematuria, status post-renal biopsy? A. Cystitis. B. Transitional cell carcinoma. C. Bladder stones. Or D. Bladder hematoma. All right, so I don't see any bladder wall thickening to suggest cystitis. Transitional cell carcinoma would be a tumor of the urinary bladder wall, but this person did have a renal biopsy. So bladder hematoma would be your best guess. So answer is D, bladder hematoma. All right, number 72. What diagnosis is most likely in this patient with hematuria and flank pain? A, nephrolithiasis. B, urolithiasis. C, bladder stones. Or D, bladder hematoma. All right, so here you got a parasagittal view of the bladder. All right, so there's no picture of the kidney, so you can't say there's nephrolithiasis from this image. You can see the bladder, you can see a dilated ureter with this echogenic structure here and some shadowing. So your best bet would be B, urolithiasis. Bladder stones would be within the bladder, whereas this stone is still within the ureter. Distal ureter at the ureteral vesicle junction, or UVJ. All right, number 73. What artifact would you expect to see when putting color Doppler over this abnormality? So if you were to put color Doppler here, what's the artifact you'd expect to see? A, side lobe artifact. B, refraction. C, Twinkle artifact. Or D, reverberation. The answer is C, Twinkle artifact. Number 74. An adolescent male presents with vomiting and severe epigastric pain. So epigastric is this area here. And elevated lipase. What's the most probable diagnosis? A, fat embolism. B, cholecystitis. C, gastritis. Or D, pancreatitis. So here we have an epigastric image showing the left lobe of the liver, abdominal rectus muscles, a little piece of the gallbladder right here, and a edematous looking gallbladder with some fluid there. Here's your portosplenic confluence. So that is an abnormal looking pancreas with some possible calcifications here. So you see a piece of the gallstone there, but you don't see any, you see a piece of the gallbladder there without any gallstones. So cholecystitis is probably not the answer. I don't see any gastric tissue here or any evidence of fat embolism. So your best answer would be D, pancreatitis, especially with the elevated lipase. So here's the tail of the pancreas. You can see it's very heterogeneous with hyper and hypoechoic parts, kind of patchy looking. And also there's some peripancreatic free fluid. Number 75. This finding has been associated with increased risk of germ cell tumors like seminoma. What is this finding? A, macrolithiasis. B, microlithiasis. C, phlebolith or phlebolith. And D, varicocele. So here you can see a transverse image showing both testicles and many punctuate echogenicities consistent with B, microlithiasis. Number 76. 4-year-old with Beckwith-Wiedemann syndrome presents with left upper quadrant palpable mass. What is the most likely diagnosis? A, splenic hemorrhage. B, renal cell carcinoma. C, Wilms tumor. Or D, renal vein thrombosis. So in this image you can see there's a kidney, sagittal view of the kidney with a tumor. Now the most common pediatric tumor, you have 4 years old, would be a Wilms tumor. Also, patients with Beckwith-Wiedemann syndrome have a higher propensity for developing abdominal tumors. So your answer would be C, Wilms tumor. Also known as nephroblastoma. Number 77. An 8-year-old presents with a palpable mass in the neck that is tender the most likely diagnosis is A. Fibromatosis coli, B. Reactive lymphadenitis, C. Thymoma, or D. Internal jugular vein thrombosis. All right. So the answer is, this is a pretty simple one, B. Reactive lymphadenitis. Number 78. The NICU orders a brain ultrasound for a very premature infant. What are the findings? A. Grade 1 bleed, B. Grade 2 bleed, C. Grade 3 bleed, or D. Grade 4 bleed. The answer is D. Grade 4 bleed. Here you can see a very smooth brain in a premature, very premature infant. This infant's probably like around 25 weeks, 24 weeks, 26 weeks. And all this echogenic mass here is hemorrhage within the parenchyma. So again, as I said before, a grade 1 bleed would be subependymal or limited to the germinal matrix. A grade 2 bleed is when the blood breaks into the ventricle but does not cause hydrocephalus or ventricular enlargement. A grade 3 bleed is when the blood breaks into the ventricle and causes ventricular enlargement. And a grade 4 bleed is intraparenchymal blood. They're not with or without intraventricular blood. Number 79. What is the red arrow pointing at in this infant spine? A. Spina bifida, B. Filar cyst, C. Tethered cord, or D. Lipoma. All right, so here we got the conus medullaris right here, central canal, and a little cystic structure right here, and the filum terminalis. So the answer is B. Filar cyst. Now, if you have a question like this that shows a cyst within the distal portion of the conus medullaris, and the answer is ventriculus terminalis, that's going to be your go-to answer. But a cyst within the filum would be a filar cyst. Number 80. A teenager presents with facial swelling, especially under the angle of the jaw, right here. What is the cause? A. Lymphadenopathy, B. Hematoma, C. Thyroiditis, or D. Sialadenitis. All right, so a lymphadenopathy would be an enlarged lymph node, which is very common down here. Thyroiditis, you would see here where the thyroid is. And a hematoma would not have internal blood flow as this image does. So this appears to be the submandibular gland with increased internal flow or hyperemia, which is sialadenitis or submandibular inflammation. So the answer is D. Sialadenitis. Number 81. What structure is the red arrow pointing to? A. Superior mesenteric artery, B. Celiac artery, C. Portal vein, or D. Splenic artery. Okay, so here you got your celiac axis, which we like to call the seagull sign. And you know that the hepatic artery goes this way and the splenic artery goes that way. So that is D. Splenic artery. So again, aorta, celiac axis, celiac artery, hepatic artery, splenic artery, a little piece of the splenic vein here, pancreatic tail, left lobe of the liver, rectus abdominis, linea alba, some little fat tissue, adipose tissue, portal vein, and inferior vena cava. Again, I speak pretty fast, so if you're having trouble following me throughout these videos, you could always choose the speed of the video on YouTube, and you can slow it down to 1.5 times or 2 times, so you can follow me better if you're having trouble understanding my speech if it's too fast for you. All right, number 82. What structure is the red arrow pointing to? A. Epididymal cyst, B. Tunica albuginea cyst, C. Tunica vaginalis cyst, or D. Varicocele. All right, so here we have a sagittal image of the testicle. All right, I don't see any increased vascularity or multiple cystic structures with increased blood flow to suggest a varicocele. All right, there's no picture of epididymis here to suggest an epididymal cyst. Usually epididymal cysts are going to be in the epididymal head towards the superior portion of the epididymis. This appears to be within one of the layers of the testicle. Now we know that within the parietal and visceral layers of the tunica vaginalis, that's where hydroceles form. but with it, the layer that covers the testicle itself would be the tunica albuginea. So that's a B, tunica albuginea cyst. Number 83. Which adrenal tumor can be found in the head and neck? A, adrenal adenoma. B, pheochromocytoma. C, ganglioneuroblastoma. Or D, adrenal lipoma. So this is an adrenal tumor, or a tumor made up of similar tissues as the adrenal gland, found in the head and neck. All right, so adrenal adenoma is within the adrenal gland. A pheochromocytoma is also found usually within the adrenal gland. And an adrenal lipoma would be benign. So your answer would be a C, ganglioneuroblastoma. Number 84. This anechoic area in the neonatal cranial ultrasound. Hold on, I gotta fix this. Ultrasound. All right. So let's go back. Number 84. This anechoic area in a neonatal cranial ultrasound represents A, intraventricular hemorrhage, B, subgaleal hemorrhage, C, cephalohematoma, or D, fracture. All right, so here we got a very superficial image showing the skin, some fluid, and the cranial bone. So already you know there's not an intraventricular hemorrhage because there's no picture, there's no image there of the ventricles. Don't let this fool you, as this is a suture. So a fracture is not part of your diagnosis because this is an infant and this is one of the cranial sutures. All right, so that leaves you with B or C. Now, a subgaleal hematoma is a larger fluid collection that does cross over sutures and does cross over midline, whereas a cephalohematoma is usually directed or associated with one side of the cranium and does not cross over midline. So your best answer would be B, subgaleal hematoma. All right. So this is your cephalohematoma here, and a subgaleal hematoma will cross over, and they can be extremely large, and they can cause the patients to lose a lot of blood, have low levels of, become anemic as well. So it's much different than a cephalohematoma. Right. Number 85. What causes this monoventricle appearance in this neonatal brain? A, hydrocephalus. B, hydranencephaly. C, cephalohematoma. Or D, holoprosencephaly. All right. So remember, usually when they're talking about monoventricle, you're speaking of holoprosencephaly. Now, holoprosencephaly is divided into lobar, semilobar, and alobar. All right, but that's not what this question is asking. You can definitely see a interhemispheric fissure here, but monoventricle. So it's not hydrocephalus. Hydranencephaly would show no cerebral tissue at all, only midbrain and cerebellum. And cephalohematoma is similar to what the other question we were asking, which is a scalp lesion. So the answer to this would be D, holoprosencephaly. Number 86. At what level does the conus end in this image? All right, so we can count from the sacrum up. So it's S5, S4, S3, S2, S1, lumbosacral junction, L5, L4, L3, and L2. And here's the tip of the conus, so it's ending at L2. B is the answer. B, L2. Number 87. Which portion of the pancreas lies posterior to the splenic vein? A, the uncinate process. B, the head. C, body. Or D, tail. The answer is A, uncinate process. Number 88. What differentiates spina bifida occulta from aperta? A, level of conus. B, sacral dimple. C, overlying skin. Or D, hairy tuft. All right, so the difference between spina bifida occulta, occulta meaning hidden, and aperta meaning open, would be C, overlying skin. Number 89. What's it called when you find both kidneys on one side of the abdomen? A, crossed fuse renal ectopia. B, pelvic kidney. C, horseshoe kidney. Or D, pancake kidney. All right, so this is an image from the right side of the abdomen, and you can see what looks like two kidneys fused together. All right, here's your psoas muscle, some iliac vessels. So the answer is A, cross-fused renal ectopia. Number 90. What is the appearance of the kidneys? What is the appearance of these kidneys called? A, cross-fused renal ectopia. B, pelvic kidney. C, horseshoe kidney. Or D, pancake kidney. So here you can see the vertebrae, and you can see a U-shaped kidney over the midline, because that's the vertebrae. You have your two iliac arteries and your distal IVC right before it bifurcates. So this would be a horseshoe kidney. The answer is C, horseshoe kidney. Number 91. What would you expect to see in the bladder of this duplex kidney with upper pole moiety dilatation? So here you have your sagittal kidney, lower pole looks fine, and you got some upper pole hydronephrosis. So what would you expect to see in this patient? A, bladder calculus. B, ureteral seal. C, ureter stricture. Or D, ureteral stone. All right? The answer would be ureteral seal. A lot of times you have duplex kidneys, and the upper pole moiety has a ureter that enters ectopically into the bladder and causes a ureteral seal. And here's the ureteral seal. So the answer is B, ureteral seal. If there was a stone, if there was a non-duplex kidney with one ureter, if there's a stone, you'd expect to see hydronephrosis in the entire kidney. Same thing with a ureteral stricture or UPJ obstruction. But in this case, you only have the upper pole that's obstructed. So you typically see upper pole obstruction with ureteral seal. Number 92. In an infantile uterus, what portion is usually largest? A, fundus. B, fallopian tubes. C, cervix. Or D, body. The answer is C, cervix. Cervix usually is the larger portion, taking up to 2/3 of the entire ureteral volume, and is very pronounced, especially in infants, from hormonal influence from the mother right after birth. Number 93. What is a common complication of acute pancreatitis? A, pancreas necrosis. B, cholelithiasis. C, pancreatic pseudocyst. Or D, diabetes. The answer is C, pancreatic pseudocyst. Here you see a large cystic structure and fluid collection in the left portion of the abdomen, right under the spleen, where the tail of the pancreas is supposed to be, in a patient with very high lipase and amylase. Number 94. This image shows the skin overlying the rectum. Which condition would cause this appearance? A, rectal tumor. B, cloaca. C, Crohn's disease. Or D, imperforate anus. All right, so the answer is D, imperforate anus. You have a rectal pouch that doesn't connect to the surface of the skin. All right. Number 95. What would you expect to see in a patient with sickle cell disease presenting with right upper quadrant pain? A, renal cyst. B, cholelithiasis. C, pancreatitis. Or D, liver mass. All right, so common complication in sickle cell patients is cholelithiasis. So you would see B. The answer is B, cholelithiasis. Their stones are usually made up of mostly bilirubin, as opposed to adults who have cholelithiasis, who their stones are usually made up mostly of cholesterol crystals. All right. Number 96. What other finding is present in this patient with hypertrophic pyloric stenosis? So over here you got a very obvious pyloric stenosis, thickened wall, very long, some fluid in the stomach antrum. All right, so on the same patient, here you see a piece of the pylorus right here. You have the gallbladder. So what are the findings do you see in this image? A, gallstones. B, adenomyomatosis. C, pancreatitis. Or D, liver mass. The answer is B, adenomyomatosis. So here's your gallbladder, and it's got all these echogenic spots with ring down artifact here. And those are usually biliary crystals that get stuck in what's called the Rokitansky-Aschoff sinuses. So adenomyomatosis. Number 97. This cystic structure above the bladder is A, urachal cyst. B, ureteral seal, C, hernia, or D, dermoid? The answer is A, urachal cyst. So here's the top of the bladder right here, and you have this cystic structure, which is a urachal cyst. A ureteral seal will be within the base of the bladder where the ureters enter. Number 98. A 4-month-old presents with this suprarenal mass. What is the most likely diagnosis? A, hepatic mass, B, psoas hemorrhage, C, neuroblastoma, or D, adrenomyelolipoma. All right, so 4-month-old, young infant, large mass within the suprarenal region. So here's your kidney, and that's above the kidney there. So your most likely answer would be C, neuroblastoma. Number 99. A patient presents with a perirectal mass with erythema and fever. What does this represent? B, imperforate anus. A, imperforate anus. B, hematoma. C, lipoma. Or D, perirectal abscess. All right, so this patient has erythema, fever, signs of infection, perirectal mass with hyperemia, and a complex fluid structure. Your most likely answer would be D, perirectal abscess. All right, number 100. What technique would you use to prove that the anterior linear structure is the CBD? A, reduce the gain. B, increase the gain. C, M mode. Or D, Doppler, color Doppler. Right? The answer is D, color Doppler. If you increase the gain, all it will do is increase the internal echoes as well and make it look like there's something inside of it. If you do decrease the gain, it will just get more darker than what it is right now. M mode will just show motion, not really helpful. Color Doppler will show that this is the portal vein, and this circular structure is a hepatic artery, and that this anterior structure is the common bile duct. All right, so that's it. This is the 100th question. I hope you guys enjoyed this pediatric registry review. I suggest to use Davies Publishing for studying. They have a CD-ROM that's good. Obviously, you have Edelman, Pegasus Lectures. You have many to choose from, Appleton and Lang. I personally almost always use Davies Publishing just because they come with CD-ROMs, and I like interactive questions and answers. So I hope you can use these 100 questions as an adjunct. I don't think it's enough to pass ARDMS quizzes, but it covers a lot that this and one other study material should definitely be enough. Expect more videos from me in the future. Please feel free to subscribe, hit the like button, and the little notification bell. I'm going to be making more videos in the future, case reviews, other in-depth videos, and I hope you stay tuned. All right, take care. Bye.